Another wave of COVID-19 cases is sweeping through Colorado, tossing another challenge to the state's rural hospitals.
And it seems like it sort of keeps coming back even harder than it was the last time.
Dr. Laura Edgar-Lee Gibb is an emergency physician who works in southern Colorado. On top of a nationwide shortage of nurses, she says this contagious strain of COVID-19 is making more staff call out sick than before.
People working long days, multiple hours, long on-call times.
Dr. Edgar-Lee Gibb says her rural hospitals will make room for the patients they can care for. But if someone needs a higher level of care, she says sometimes it's taking longer to transfer a patient because the bigger hospitals are also overwhelmed.
And sometimes their emergency department can have 20 or 30 patients sitting there waiting for a bed. You know, there are multiple times that we're holding patients upwards of 24 hours for services.
And sometimes when they can find a bed, she says there can be a delay from EMS crews. They're also struggling with staffing, and the transport may not be to the nearest hospital.
There may be a hospital now that's 4 or even 6 hours away that can take the patient.
It's been a draining 2 years for healthcare workers, but they don't want this challenge to stop someone from seeking care if they need it.
We're here and we want to manage your emergency.
Now, Dr. Edgar-Lee Gibb says there is a fear that someone could come into the emergency department for a treatable condition, but the patient can't get transferred for care because there's no space at another hospital. However, she does not believe that the state is at that point yet, Jenny.
That's good news because that is one of the biggest fears with all this, right?
Yes, they are terrified that that could happen. That has, they've heard of stories of that happening in other states. They have not heard that situation taking place. At least this doctor that I spoke to has not heard of that.
I'm just not sure the general public understands how many pieces of the puzzle for this kind of care exist. So
it's so many different layers, and healthcare workers are just really hoping for a break at this point.
Kelly, thank you.